Welcome back, everybody. We're going to be taking a look at UnitedHealth Group,
Okay.
the nation's largest healthcare conglomerate.
Huge.
Yeah, they've been facing quite a bit of scrutiny lately, and in just 3 months, their stock has plummeted 23%.
Wow.
So let's explore what's happening behind the scenes. But before we go any further, if you're enjoying these explorations of complex topics, be sure to hit that subscribe button and give this video a like. It really helps us out.
Yeah, for sure.
So,
The Department of Justice has launched an investigation into UnitedHealth's Medicare Advantage billing practices, specifically focusing on potential upcoding.
upcoding.
Yeah, this is a tactic where a provider might inflate the severity of a diagnosis to receive higher reimbursements from Medicare.
And this isn't just like a small thing. There are reports that Medicare may have already overpaid UnitedHealth billions of dollars for what some are calling questionable diagnoses.
Right, and this is particularly within physician groups owned by the company.
Oh, wow.
So there's a lot of layers to this.
And of course, UnitedHealth denying any wrongdoing. They're vehemently pushing back against these accusations. But the fact that the DOJ is involved raises some serious red flags.
Absolutely. The DOJ doesn't initiate investigations lightly. This suggests they have reason to believe there might be systemic issues with how UnitedHealth is building Medicare. We're potentially talking about fraud charges here, which could have significant legal and financial repercussions.
Yeah, this is serious stuff. And adding fuel to the fire is billionaire investor Bill Ackman, who has publicly clashed with UnitedHealth. He even went so far as to offer to cover the legal fees for a Texas doctor who's in a dispute with the company.
Oh, wow.
This doctor alleges that UnitedHealth pulled her out of the operation midway through
What?
to justify denying coverage for the patient's care.
Wow.
It's pretty wild.
Ackman's criticisms are particularly noteworthy because he's a highly influential figure in the financial world.
Yeah?
He's essentially arguing that UnitedHealth profitability might be artificially inflated by denying medically necessary procedures. So this raises concerns about the company's ethical practices and whether they're prioritizing profits over patient well-being.
It's interesting that Ackman did initially call for a Securities and Exchange Commission investigation into UnitedHealth's practices. However, he later backtracked and deleted a critical social media post after facing legal pressure from the company.
Oh, interesting.
But even with the retraction, the damage was done. His accusations brought significant negative attention to UnitedHealth.
Absolutely. And this negative publicity comes at a time when the company's already facing internal pressures. They've recently offered buyouts to employees and have hinted at potential layoffs if not enough people accept them. This suggests they're looking to cut costs, which could be a preemptive measure to brace for potential financial fallout from the DOJ investigation.
On the surface, they're framing these buyouts as a move towards leveraging digital technology and streamlining operations. But it's hard not to view this through the lens of the external pressures they're facing. It raises questions about whether they're sacrificing employee stability to protect their bottom line.
Yeah, I see what you're saying. And we have to remember this is all happening against the backdrop of that cyber attack on their subsidiary Change Healthcare last year.
Right.
Remember, this breach compromised the sensitive health information of a staggering 190 million people.
That's almost 2/3 of the entire U.S. population. The implications of such a massive data breach are truly alarming.
Absolutely. UnitedHealth has already had to pay out over $3 billion to providers affected by the breach.
Wow.
And there could be further financial repercussions down the line,
Yeah.
not to mention the erosion of trust among patients and providers.
Right.
This attack really underscores the vulnerability of healthcare data in an increasingly digital world.
This cyber attack, coupled of the other challenges they're facing, paints a picture of a company struggling to maintain control. And on top of everything else, the tragic killing of their CEO Brian Thompson back in December further intensified the scrutiny on UnitedHealth and the insurance industry as a whole.
Yeah, that incident really struck a nerve with the public. It ignited widespread anger and criticism directed at the industry.
It brought to light the deep-seated frustrations many people have with health insurance companies, particularly when it comes to denials of care.
Thompson's death, while a terrible tragedy, became a symbol of the perceived callousness and profit-driven nature of the healthcare system. It led to renewed calls for reform and increased scrutiny of how insurance companies make decisions about coverage.
It's important to note that UnitedHealth is far from the only player facing scrutiny. The entire healthcare landscape is under a microscope right now. People are demanding more transparency, accountability, and a greater focus on patient well-being.
It's interesting how all of these issues we've been discussing intersect with the broader debate about healthcare reform in this country. Some argue that the system is inherently flawed, prioritizing profits over people, while others defend the private insurance model, emphasizing choice and innovation.
Yeah, it's a complex issue with strong opinions on all sides.
Definitely.
But this case with UnitedHealth brings many of those arguments to the forefront. It raises questions about how we balance the need for cost containment with the imperative to provide quality care. And it highlights the potential conflict between the interests of shareholders and the needs of patients. It also raises questions about the role of technology in healthcare. UnitedHealth's push towards digital solutions, while framed as a way to streamline operations and reduce costs, has sparked concerns about potential unintended consequences.
Yeah, there are valid concerns about whether this increased reliance on technology could actually create barriers to access for certain populations.
Like who?
Particularly those who are less tech-savvy or who lack reliable internet access. There's a risk that these digital solutions, while potentially beneficial in some ways, could exacerbate existing health disparities.
It's crucial to consider the equity implications of any technological advancements in healthcare. We need to ensure that these innovations benefit all patients, not just a select few.
Absolutely. And it's not just about access. There are also concerns about data privacy and security in an increasingly digital healthcare system.
Right.
The Change Healthcare cyberattack is a stark reminder of the vulnerabilities we need to address.
So where does this leave UnitedHealth? They're grappling with a DOJ investigation, public criticism from high-profile figures like Bill Ackman, internal cost-cutting measures, the aftermath of a massive data breach, and a renewed push for industry-wide reform. Can they weather this storm?
It's a pivotal moment for UnitedHealth. They're facing a crisis of confidence, and their actions in the coming months will be critical in determining their future. They need to demonstrate a genuine commitment to addressing these concerns and restoring trust with patients, providers, and investors.
They need to show that they're not just about protecting their bottom line, but that they're truly prioritizing patient well-being and contributing to a more equitable and sustainable healthcare system.
Exactly. This could be an opportunity for them to step up and become a leader in driving positive change within the industry, but it remains to be seen whether they'll seize that opportunity or continue down a path that prioritizes short-term profits over long-term sustainability and ethical considerations. The stakes are high, not just for UnitedHealth, but for the future of healthcare in America.
We'll certainly be watching closely to see how this all unfolds. Thanks for joining us for this look into the challenges facing UnitedHealth Group. It's a complex and evolving situation with implications that reach far beyond a single company. We appreciate you being here for the conversation.